Okay, greetings from sunny California. I am delighted to be here. I really enjoyed Uta and Christian's conversations and their presentations. I am a professor of epidemiology and population health, as well as of medicine at the Stanford University School of Medicine here in Northern California. So I always like to start by doing just a quick shout out to my village, since it takes a global village to do this kind of work. And so here's just a list of my US collaborators and my international collaborators, and I don't have any financial disclosures to be made. So my goals today are just to again provide a perspective on the citizen science approach, and in particular focusing on healthy living and health and environments. And I'm going to be describing a particular form of what we call by the people citizen science, or what Uta talked about as shared or co-created citizen science. It really serves to engage all residents in building healthier and sustainable communities. And then I'll briefly discuss some future directions for this kind of participatory action method. So we've heard a lot about policy this morning, which has been fantastic. We think that to optimize healthy living and sustainable environments, we really need the two approaches that have been mentioned. One is the top-down policy approach. The other is the bottom-up approach through activation of residents as citizen scientists who, and as we've been hearing, they can really help to identify and improve the factors relevant to a particular community, population, or circumstance. We've heard what citizen science is. My group likes to stress the fact that when we're talking about citizens, we're using the traditional definition of citizens, inhabitants of a particular town or city without regard to legal status. We talk about the three general types that map onto very nicely onto Uta's description for the people citizen science. In the health field really has to do with things like donating biological specimens and personal information to the research endeavor, but people's participation really ends at the clinic door. Then we've heard a lot, and Christian talked a lot about this, the with the people types of citizen science, that where there's active data collection. Christian, I just loved your great koala count. We do great bird counts here in the US, as well as counting all kinds of other things. The data, as we've heard, get pushed usually to the researchers, and then the residents stop their participation oftentimes. What we do is this co-created by the people type of citizen science with the aim of engaging residents in the whole method of science, including participating in setting objectives, collecting and helping interpret data, and building realistic solutions in their own communities. So I'm going to be talking about our example of that kind of citizen science that's called Our Voice. So Our Voice activates residents to assess and advocate for healthier neighborhoods and communities, working in partnership with local decision makers, and the local facilitators who are involved learn how to support residents throughout the entire process. This kind of citizen science is based on the premise that among the most underutilized renewable resources on the planet to promote both human and planetary wellness and equity are residents themselves. So by the people, citizen science draws from two perspectives. One is called community-based participatory research, where residents participate in problem identification and local community applications. And then the citizen science method that brings the systematic, scalable procedures to resident-based real-world data collection. And we use a combination of qualitative and quantitative methods. So Our Voice starts with an easy-to-use mobile app called the Neighborhood Discovery Tool. This app is used by residents irrespective of tech literacy or language to assess community features that either promote or hinder healthy living, or other issues that are facing the community. The Discovery tool is currently in 13 languages and growing. We would love, Maria, to get it into Finnish. Hopefully, we will be able to do that at some point. The information is collected via GPS route tracking, walking maps, and geotagged photos, and audio text narratives, and then very simple ratings. It's available on either Apple or Android platforms. The data are anonymized and de-identified, and successful users have ranged in age anywhere from 9 to over 95 years old. So there's a guiding question, which can be whatever the community and the scientists think is the most useful. And it usually starts with what makes it easy or hard to, and here are just some examples: be physically active in my community, access healthy food, with a nod to Christian's wonderful presentation, feeling safe in my community, controlling my stress, avoiding COVID-19, lowering my carbon footprint. So it can be virtually anything that the community and the organizers and organizations involved believe is really important. The Discovery tools and multidimensional data are accessible and meaningful to residents, decision makers, and researchers alike. And you can see here the rating of the smiley. Here's the frowny face in red. So when you first look at the photo, you see a crosswalk, which most of us would think would be a good thing, would be rated positively, but it's rated negatively. Well, why should that be? Well, as it turns out, this crosswalk ends in a ditch. It does not go across the entire street, so residents actually can't use it. So this is an example of how getting this kind of micro scale data is so important. These kinds of data can then be grouped to identify community hotspots, with green being positive features, red being negative features, and orange being a mix of positive and negative features in the local community. We're exploring different kinds of data visualizations with these data using Google Earth or the Street View feature on Google Maps. This was a project done by one of our junior investigators in Thailand. We can also combine the Discovery tool with mobile sensing devices. So this was done by one of my postdoctoral fellows in San Francisco, where he had the use of wrist-worn sensors of electrodermal and heart rate activity that people wore as they walked around San Francisco, and used the Discovery tool and could identify locations linked with increased arousal and stress through these kinds of sensors. So there's a Discovery tool data portal where local project facilitators can log into a secure database that has unique IDs, and it allows the local facilitators to view and process the Discovery tool data. And then the data are returned to the citizen scientists for facilitated analysis, interpretation, and advocacy. We also have a dashboard and toolkit that's a one-stop shop for project management, tracking, and reporting. It includes customizable recruitment and training materials, meeting facilitation guides, and Discovery tool user manuals, things like active or action planning templates to help people organize the participatory action part of the method, and then all kinds of sample documents such as IRB, ethics protocol samples, consent documents, and other kinds of information. And we're currently building a library of evaluation measures to facilitate and track impacts. So the next step of this process moves us from data collection to action by having residents together share, either remotely or in person, their photos and stories collected on their walks. They then build consensus around high priority yet realistic areas for change in their local environments, and they learn how to share their data with key decision makers and develop feasible solutions, which lead to formulating action steps to actually activate local changes Here we see a map in Israel developed by older adults that were able to identify for them age-friendly walking routes for the community of Israeli seniors, and they were able to bring in the support of businesses to help facilitate that process. So the multi-level research model that we use is aimed at cascading effects. It starts with the intervention, the Our Voice intervention, which can create changes in mediators, things like neighborhood cohesion and trust, self-efficacy to affect environmental change, or other things like neighborhood social networks, which in turn lead to changes in relevant neighborhood community structures, policies, and social activities, which in turn have been associated with distal outcomes, things like individual level health behaviors and outcomes, as well as neighborhood level outcomes as well. We know there's a lot of compelling research from a number of different fields showing that local environments are associated with lots of health and well-being outcomes. What tends to be missing is how do you get those environmental changes made, especially when top-down policy methods may not be as accessible, which we find in underserved communities oftentimes. So this is where Our Voice is working. We use multidimensional outcome measures. I've mentioned some qualitative measures and geospatial and mapping visualizations, as well as quantitative measures, sensing and observational information. So one of our early projects happened in East Palo Alto, which is a completely different city than Palo Alto, where Stanford University. It's sort of a tale of two cities. East Palo Alto is under-resourced, ethnically diverse city in a different county in California. And the older residents at an affordable public housing site in East Palo Alto were able to learn from the Our Voice facilitators how to use the discovery tool to identify neighborhood assets and barriers to physical activity and healthy eating. They then discussed, organized, interpreted, and prioritized their data, and they advocated for change. And in response, the City Planning Committee and the City Council made a number of investments to enhance the community infrastructure for healthy living. These things included creating a safer walking environment through revising and repairing the streets and sidewalks in East Palo Alto. They improved access to the local senior center. Residents recruited local organizations to develop a community garden, and they learned how to grow and cook their own vegetables from that garden. They also discovered, interestingly, that a nearby food market actually had more fresh produce than originally thought. So one of the things we love about the discovery tool is that it opens people's eyes to what's really in their neighborhood, and it helps them to be more mindful of actually taking stock of what's going on. And oftentimes they discover things that are quite positive that they really didn't know were there. The city also appropriated new funds for environmental analysis, and there were increases in social cohesion and engagement among the citizen science participants. So we've worked in 8 sectors and settings so far, including neighborhoods and the community at large, parks, schools, clinics, food outlets, work sites, public housing, and transit. And the demonstrated successes of Our Voice in diverse and often under-resourced communities include things like the walkability infrastructure repairs that I mentioned, and increases in public transit use, more greenery and gardens, healthier school environments and safer routes to schools, increased access to healthy foods, more age-friendly community events and groups, safer indoor clinical centers and settings, safer activity supportive parks and recreational spaces, and increases in people's feelings of agency and efficacy and connectedness. So the methods that we've applied include comparison designs. For instance, one example is a Safe Routes to School program. Safe Routes in the US is a national program. In 1969, half of US children were walking or biking to school, and that dropped by 2009 to only 15%. So the question we had was, could we add our voice to the standard Safe Routes program to increase community engagement and promote more walking and biking to school? In this case, an elementary school in a rural, under-resourced area of our county. The parents served as citizen scientists, and the public health department was the community facilitator. And what we found is that the elementary school, okay, thank you, actually receiving Safe Routes plus Our Voice held twice as many Safe Routes engagement activities than the other program that did not have Our Voice. And they also had 1 year walking and biking rates that were twice that of the Safe Routes Alone school. We've also shown this kind of citizen science to be acceptable and feasible with middle school students who they themselves were the citizen scientists. We've run clinical trials seeing if Our Voice could actually augment and sustain the effects of community physical activity interventions in under-resourced communities. In this case, it was inactive older men and women living in or around senior affordable public housing sites. We found that those receiving Our Voice, in addition to the regular physical activity program, were able to achieve a number of environmental changes and also have shown at 12 months increases in walking behavior, walking minutes that were greater than those receiving the health education control program. So there have also been natural experiments, one that has been occurring in Bogota, Colombia, looking at their mass transit cable car system for underserved and vulnerable populations. They used a pre-post mixed methods design, of which Our Voice was one. They were able to link this implementation in the settlement that received the Transmicable station compared to the one that didn't, in terms of all kinds of positive changes, things like reductions in perceived stigma and improvements in being able to access things in Bogota for the first time. And they also found that these qualitative methods, including Our Voice, actually really added to the information that they were able to capture that was not captured in your typical quantitative surveys, things like increased social cohesion, feelings of local democracy, housing quality, and some food issues that hadn't come to light before that. So these successes have created accelerating demand. We have run over 80 projects worldwide. 18 US states have been involved in over 20 countries spanning 6 continents. We've worked with over 30 universities and also have worked with over 20 community-based and government organizations who were the primary facilitators of this kind of research. So our goals are really to build an online interactive world map of citizen science data and results for all to use, from residents to researchers and policymakers and community organizations and business groups. And then the goal would be to link it with other data platforms to really add this lived experience information that's typically lacking. And the goal, the ultimate vision, is to inspire a global citizen science movement to build healthy communities and planet. We're continuing methods refinement to further capture the multi-level impacts of this kind of citizen science. New populations and use cases are being sought out, and we're continuing to combine the quantitative methods and mobile sensing data. And we would love to hear your ideas on where this kind of participatory action citizen science can go. So in closing, I'd like to end with a quote that's often been attributed to Margaret Mead that goes, "Never doubt that a small group of thoughtful, committed citizens can change the world." Thank you.